but can tell us a lot about our overall health, the appearance of our tongue. Specifically, we're going to discuss what a white tongue can mean in the context of HIV and AIDS. It's a topic that can cause a lot of worry, so my goal here is to break it down and provide clear information and empower you with knowledge. Your mouth is often considered a window to your body's health. Many systemic diseases can show their first signs right inside your mouth. This is why doctors and dentists always take a good look in there during a checkup. When we talk about HIV, we're talking about a virus that attacks the body's immune system. Over time, if left untreated, HIV can progress to AIDS, the most advanced stage where the immune system is severely damaged. In this discussion, we're going to cover 5 essential facts you need to know about the link between a white tongue and AIDS. Let's dive into our first and most important fact. When a person with HIV or AIDS develops a white tongue, the most common cause is oral candidiasis, more widely known as oral thrush. It's caused by an overgrowth of a fungus called Candida albicans. Candida is a normal resident of your mouth. In most healthy people, this fungus lives harmlessly, kept in check by a strong and vigilant immune system. Think of the immune system like a bouncer at a club, keeping order. When the immune system weakens, Candida can multiply and form visible white patches. These patches often look creamy white, sometimes like cottage cheese. If you scrape them gently, you may reveal red inflamed tissue underneath, a diagnostic clue. They can appear on the tongue, inner cheeks, roof of the mouth, gums, or the back of the throat. Oral thrush can occur in babies, in people on steroids, and importantly, in adults as a clinical indicator when persistent. Recurrent or persistent thrush in an adult can be an early sign of immune compromise and should prompt evaluation. For someone with known HIV, it could signal treatment needs review or that the virus is progressing. Recognizing thrush is about understanding what it tells us about the entire immune system. To truly grasp why oral thrush is common in people with HIV or AIDS, we need to look at the science. The immune system is an incredibly complex network of cells, tissues, and organs that defend the body. A key player is the CD4 T cell, or T helper cell. Think of them as the generals of your immune army. They coordinate the immune response, telling other cells what to do and when. HIV specifically targets and hijacks CD4 cells, entering them and using their machinery to replicate. In the process, it destroys them, and the CD4 count drops over time, measured by the CD4 blood test. A healthy CD4 count is roughly 500–1500 cells per cubic millimeter. Lower counts mean a weaker immune system. Opportunistic infections like Candida take advantage when immune surveillance fails. The mouth is warm and moist, an ideal environment for Candida to flourish when unchecked. Oral thrush is a direct consequence of HIV's damage to the immune system's command structure. When CD4 counts fall below about 200, the body typically can't control Candida, and thrush becomes common. This is why thrush is considered an AIDS-defining illness in some contexts. Visible signs like thrush are tangible signals that the immune system is severely compromised and require prompt attention. Effective antiretroviral therapy can stop viral replication and allow immune recovery, reducing opportunistic infections. As CD4 counts rebound, the body regains control over fungi like Candida. Next, we'll look at how a weakened immune system opens the door to infection. Our second key fact: a weakened immune system opens the door to a white tongue. The sentinels, including CD4 cells, spot threats early. Introduce HIV, a saboteur that targets those sentinels and reduces their numbers. With fewer guards, the communication network breaks down and the gates are left unguarded. That vulnerability allows Candida to multiply rapidly and cause visible thrush. This problem extends beyond oral thrush. Pneumonia and certain cancers can also appear when immunity falls. ART stops HIV replication and allows CD4 counts to recover, rebuilding the fortress and securing the gates. That's why early diagnosis and adherence to treatment matter, to prevent opportunistic infections. With effective ART and care, the body regains control. Next, how a white tongue can act as a warning sign. Our third fact is a critical one. A white tongue can serve as an important warning sign related to the progression of HIV. For a person unaware of their status, the sudden appearance of stubborn oral thrush can be the first clue that something is wrong with their immune system. It should prompt a conversation with a doctor and consideration for HIV testing. For someone already diagnosed, a new or recurring thrush can indicate the virus is progressing or treatment needs review. It often corresponds to a drop in CD4 count, especially below the important threshold of about 200. Healthcare providers may check viral load and CD4 to see if treatment adjustments are needed. This could indicate drug resistance or adherence issues that require action. Think of thrush as a check engine light for the immune system, a prompt to see your doctor, not a reason to panic. Timely investigation can prevent further immune decline and serious complications. Next, we'll look at other causes of white tongue in people with HIV or AIDS. While oral thrush is the most frequent culprit, our fourth fact is that other conditions can also cause a white tongue in people living with HIV or AIDS. It's important not to assume that every white patch is thrush. One significant cause is oral hairy leukoplakia caused by Epstein-Barr virus. It creates corrugated, hairy-looking patches usually on the sides of the tongue. Unlike thrush, OHL cannot be scraped off, and its presence strongly suggests severe immune suppression. Poor oral hygiene can cause a harmless whitish film of dead cells, food debris, and bacteria. Dry mouth from medications or HIV itself reduces saliva, allowing coatings to form. Other conditions like lichen planus or geographic tongue can produce white patterns. In rare cases, persistent white patches might represent precancerous or cancerous changes, something more likely in people with HIV. A proper diagnosis by a healthcare professional, exam, possible biopsy, is essential to choose the right treatment. Self-diagnosis is risky. An expert ensures the correct treatment for the specific cause. Our fifth and final fact is empowering. A white tongue caused by these conditions is treatable, and there are steps to prevent it. The approach depends on the underlying cause. If it's oral thrush, antifungal medications are the mainstay. Topical nystatin for mild cases, systemic fluconazole for severe or esophageal involvement. Topicals like medicated mouthwash or clotrimazole lozenges apply medicine directly to the area. Oral hairy leukoplakia is often benign and asymptomatic. Treatment focuses on improving immune status rather than the lesion itself. The most effective long-term prevention is effective antiretroviral therapy, ART, which restores immune control. Good oral hygiene. Brush twice daily, floss, and gently clean your tongue or use a tongue scraper. Clean dentures daily, stay hydrated, chew sugar-free gum or use saliva substitutes if dry mouth is an issue. Combined measures, ART, antifungals when needed, and oral hygiene are the best way to manage and prevent a white tongue. With proper care, oral problems resolve and quality of life improves. Next, let's underscore the broader importance of oral health for people living with HIV. We've talked causes and treatments. I want to dedicate a moment to underscore oral health importance for anyone living with HIV or AIDS. It's not just about preventing a white tongue, it's about supporting overall health and quality of life. Daily routine: brush 2 minutes twice a day with fluoride toothpaste, floss daily, and gently clean your tongue. Regular dental visits, at least twice a year or more if recommended, are essential for people with HIV. Dentists can spot early signs like thrush, OHL, gum disease, or suspicious lesions that need further evaluation. Good oral health helps you eat, speak, and socialize comfortably, supporting nutrition and strength. Be open with your dentist about your HIV status so they can tailor care to your needs. These habits protect your mouth and contribute to long-term health and resilience. Today we've broken down what a white tongue can mean in the context of HIV and AIDS, most often oral thrush caused by candida when immunity weakens. HIV attacks CD4 cells, creating vulnerability. A white tongue can be a warning sign and a prompt to review treatment or test. Act. Seek professional guidance, get blood work when needed, and stay on ART where indicated. Knowledge is power. Thank you for learning about this important topic. Stay informed, stay healthy, and I'll see you in the next video.